One of the most commonly asked questions again is, what stage of dementia or cognitive decline am I in? And this interests both the patients as well as caregivers equally. So that's what we're going to talk about in this video. Now, when we talk about stages of cognitive decline, it is very important to also address that there is some expected cognitive changes that happen with normal aging. So with our aging, we are expected to become a little slower, our processing speed goes down, and we do make occasional mistakes with our memory, as well as have some word finding difficulties. But when these changes become more than what is expected for your age, then is when we start calling it cognitive impairment. And when we start talking about cognitive impairment, we say there is subjective cognitive impairment, there is mild cognitive impairment, and then there is dementia. So subjective cognitive impairment, just as the name suggests, is when the person themselves are experiencing some subjective changes. They're noticing some decline in their cognitive abilities. This could be memory, this could be language, this could be executive function, or visuospatial skills. But when they go to a doctor and the doctor gives them an objective test, they actually do very well. Now, this can happen with individuals who have a high level of education, high level of compensation. So even when they are noticing some memory problems, they might be compensating really well to perform well on these tests. So we continue to follow these individuals through the years to see if they develop further cognitive decline. The next stage is the mild cognitive impairment. In this stage, what happens is that whatever changes that you are noticing when a doctor does a cognitive test, a small cognitive test, or when they send you to a neuropsychologist to do a big cognitive test, we also notice some cognitive changes. And we also see that these changes are more than expected for your age. So this is when we call someone has mild cognitive impairment. But most importantly, during this stage, individuals are still able to do their activities of daily living. They're able to pay their bills. They're able to take their medications, drive, take a bath, dress without any difficulties. This also brings to an important factor, that is, individuals who have subjective cognitive impairment or mild cognitive impairment may not necessarily transition into dementia, because sometimes we find that these impairments can happen due to issues like mood disorder, poor sleep, and other medical conditions. Now, going into dementia, this is when your cognitive difficulties are to such an extent that you start experiencing difficulties in your day-to-day activities of living, such as you have difficulties with managing your finances, your own medications, and managing cooking or grocery shopping. And